The coronavirus outbreak has impacted the most vulnerable in our society, affecting men, women, girls, and boys all differently. The COVID-19 pandemic has brought in its own social-economic challenges, burdening the healthcare system across the region. Gender-based violence continues to increase in the region, especially sexual assaults associated with child marriage resulting in teenage pregnancies. In Kenya, during the first 3 months of lockdown, more than 150,000 teenage pregnancies were reported. Malawi reported over 12,000 teen pregnancies and child marriages. The GBV Command Center in South Africa recorded a spike in cases reported during the first 3 weeks of its lockdown. 674 cases were recorded in one day alone. COVID-19 has disrupted livelihoods and impacted smallholder farmers, mostly women. These farmers lack access to markets due to travel restrictions and food price hikes. Cross-border trade stops when borders are closed. This impacts economies. Many small and medium-sized businesses, where most women work or own, face closure and bankruptcy with no social protection. The situation in refugee and IDP camps in several countries in East and Southern African region is worse since the COVID-19 pandemic. Basic facilities such as water, sanitation, and hygiene are shared. Practicing social distancing is challenging in overcrowded settlements in South Sudan, Kenya, and Uganda. The already dire economic status of many displaced persons becomes even more precarious. Women's leadership and participation gives a voice to the needs of those who are often unheard. In times of disaster response and lockdown, normal participation in democratic decision-making, especially by civil society organizations, is interrupted. Lockdowns increase authorities' control, carrying risks of abuse of power and infringing human rights. UN Women is at the forefront of the COVID-19 response, leading gender analysis, tracking the impact on women and girls, and advocating for a gender-responsive approach to the pandemic. UN Women supported the expansion and the establishment of gender-based violence helplines to assist survivors with information and linking them to service providers for help. UN Women supports women to learn safe practices for trade with proper hygiene in Zimbabwe. In Tanzania, women are assisted with sewing machines for mask making and other enterprises. In Rwanda, UN Women assisted with providing more than 700 patients with 3 healthy meals a day and financially empowered hospital staff. UN Women Tanzania partnered with the Ministry of Labor, Empowerment, Elderly Women and Children in Zanzibar, producing 20,000 face masks to distribute to 10,000 women for free. In Mozambique, UN Women distributed 10,000 face masks to women and girls, including 200 owners of barbershops and beauty salons. UN Women Rwanda supported a business clinic launch, providing strategic guidance and advisory services to women entrepreneurs, which resulted in the production of over 50,000 reusable masks distributed to the vulnerable micro-business women. UN Women and partners provided psychosocial support in quarantine centers as well as the refugee settlement in Uganda. The program, funded by Sweden, has helped more than 2,000 refugees and local residents, from which 1,560 are women. In Kenya, UN Women, supported by Japan, works to empower refugee women, promoting leadership and financial independence in crisis response. The African Women Leaders Networks in Kenya, Mozambique, Tanzania, and Zimbabwe have all played an active role in ensuring women's leadership in the COVID-19 response. They have advanced women's voices in the preparedness, planning, response, and recovery stages of the pandemic. The UN Women Regional Office is engaging with the Council of Traditional Leaders of Africa to ensure effective participation of men and faith-based organizations in preventing violence against women and girls during the COVID-19 pandemic. In Uganda, UN Women supported 160 women peace mediators to continue to raise awareness on COVID-19 and document conflict incidences in their communities. During the 3-month lockdown, they managed to mediate 48 conflict cases, 34 cases were resolved, and 14 cases were referred for further management. By continuing to empower women economically, UN Women helps make them resilient to shocks like this pandemic. Through advocating for greater leadership for women, UN Women puts the focus on their needs and help them achieve more of a voice. Supporting the battle against GBV keeps the focus on the struggle and helps eliminate the suffering many women quietly endure. Our messaging is consistent on risks and responses to COVID-19. With continuous support and clear messaging, UN Women can help women and their families have safer and healthier lives. Together, we can do this.